Hi, and welcome to Redeemer Baby. My name is Amanda Gilson, and I'm a registered nurse and board-certified lactation consultant working with the Women's Care OBGYN practice at Redeemer Health. I've been working in the healthcare setting for over 9 years, and I'm dedicated to providing education and support during pregnancy and the postpartum period. Redeemer Baby welcomes you to join us to discuss what to expect with breastfeeding in the first few days to weeks after giving birth. You might ask yourself, when is the best time to start feeding? As soon as possible. It's best to put the baby to the breast or start expressing within the first 6 hours after the baby is born. Starting to express shortly after the baby is born will make a huge difference in your future supply. You'll also want to do as much skin to skin as possible. Skin to skin with your baby helps increase your oxytocin levels, which is otherwise known as the love hormone. This, in turn, can reduce stress levels, promote healing, and overall well-being. You might be worried, but your first nursing session can sometimes take up to 45 minutes. Remember, both of you are learning, and it's been a really long journey for your baby to get here. Have you ever heard of something called colostrum? Maybe you've heard it called liquid gold. Well, that's exactly what it is. Colostrum is the earliest breast milk that is produced. It can be super thick, it lines the baby's stomach, and it is packed with white blood cells and antibodies that help build your baby's immunity. Even the smallest bits can protect your baby for a lifetime. How much does my baby really need? In the first few days, your baby only needs about 1 to 5 teaspoons of colostrum. The stomach is similar in size to a marble, this pink one here, and it will stretch gradually as your milk supply increases. The smaller amounts of milk, aka colostrum, and its thick consistency serve to help your baby learn how to suck and swallow and breathe all at the same time. When will my milk come in, or when will it change? Milk transitions from colostrum to transitional milk around days 2 to 5. Sometimes it can take a little bit longer. You'll notice a huge change in your breast. They get larger, heavier, and sometimes people even describe them as being hard as rocks. Most people describe them as being engorged. The common misconception with engorgement is that the breasts are completely filled with milk, but that's actually not the case. The engorgement is actually due to an increased amount of blood flow and inflammation in the area. Small amounts of milk is completely normal in the first few days. Engorgement usually only lasts for about the first 24 hours. Is breastfeeding painful? Sometimes it can be in the first 2 weeks, but usually over time it gets better, especially after the first 2 weeks. It can take some time for the baby and yourself to get used to latching onto the breast. However, pain should not be ongoing. If you're noticing scabbing or discoloration of your nipples, it is definitely important to be evaluated for positioning in the latch. Ask to see a lactation consultant in the hospital to address any potential problems. Why is my baby losing weight in the hospital? Breastfed babies tend to lose at least 7 to 10% of their birth weight in the first few days. If your baby loses more than 10%, it is extremely important to be evaluated for latch and milk transfer. A baby should always regain their weight lost by the first 10 to 14 days of life. How do I know if my baby is getting enough? Well, what goes in must come out. Wet and dirty diapers are extremely important to keep track of to make sure that they're growing, staying hydrated, and receiving adequate nutrition. Follow up with your pediatrician and lactation consultant is a great benefit. If you feel like you need a lactation consultant, please reach out to your provider or contact the Breastfeeding Resource Center to schedule an appointment to be seen. Lactation consultants are generally covered under insurance for up to 6 visits.